If you're watching this video, it's because you or someone you care for is living with a condition called foot drop. As you are no doubt aware, foot drop can make the simplest of tasks, such as going to the kitchen or the mailbox, a challenge. This can significantly limit your independence. Like others with foot drop, you know only too well that activities most people take for granted, such as strolling around a park, require so much effort that you often limit your involvement or avoid such activities altogether. Now there's a new treatment option called WalkAide that can give you back the mobility you've lost and the freedom you've longed for. In this presentation, you'll hear patients and clinicians talk about how WalkAide has changed lives. But first, let's review what foot drop is. Foot drop is a condition that results from many different medical conditions, including stroke, multiple sclerosis, cerebral palsy, and spinal cord injury. It presents as weakness or paralysis of the muscles involved in lifting the toes. This causes a person to drag the foot on the ground, which can lead to subsequent pain or discomfort in other joints, the hips, back, and knees.
The biggest challenge was walking, and just everyday walking, such a matter of walking a couple of blocks to the local grocery store, and dealing with the pain in my left ankle, in my left knee, in my left hip, and in my back area, which resulted from the contorted way that a person with a stroke would walk.
So what happens is a lot of patients, if not most, try not to walk very much. And that means that they lose a lot of their independence. Means that they don't get very much exercise, even of the general kind that we normally get as we go through our normal daily activities.
While surgery may be appropriate for some cases of foot drop, until now, the main treatment option has been some form of an orthosis that braces the ankle in a 90-degree angle.
Well, the first appliance that I had was a knee ankle foot orthosis, and I used it for 2 to 3 months, I guess, and I found it very difficult, although it was so great to be upstanding and walking. You know, it almost brought tears to my eyes, but I had to use all my muscle groups, my shoulders, my neck, my lower back, my thigh muscles, just to swing my leg through, and it was exhausting. I couldn't go 50 or 100 meters and then I'd be ready for a nap.
Now there's a revolutionary new option in the treatment of foot drop called WalkAide. WalkAide is the first medical device in the world developed using Myo Orthotics Technology, a recent breakthrough in medical science. Myo Orthotics Technology represents the merging of orthotic technology, which braces a limb, with electrical stimulation, which restores specific muscle function.
By stimulation, we can activate those muscles and get an active orthosis rather than simply holding the leg in one position or another. So it offers a whole new realm of function for people.
Although WalkAide is a highly advanced medical device, it is surprisingly small and discreet and quite easy to use. It consists of a battery-operated control unit and flexible cuff. 2 electrodes inside the cuff are positioned along with a device just below the knee. Sophisticated sensor technology sends gentle electrical impulses to simulate normal nerve function and activate the muscle. This enables the user to raise the foot at the appropriate time during walking. The result is a much more natural and efficient gait.
It's improved my ability to walk in that now I'm feeling a lot more stable and a lot more secure on my feet because I'm planting my foot much more squarely, and I don't swing my left leg in the fashion that I used to before. It's certainly made walking a lot more enjoyable and a lot more easy.
WalkAide is applied directly to the patient's leg, not implanted underneath the skin, which means no surgery is involved.
It takes 5 to 7 seconds to put it on. I can just push up out of my chair and I'm good to go.